Welcome. Welcome to the Interdisciplinary Behavioral Health Collaboration Project at Westfield State University. This 1-hour module being presented today is the intersection of nursing and social work in the role of interprofessional education. This module was created by Dr. Nora Patakula, Professor of Social Work at Westfield State University, and Dr. Joyce Thielen, Associate Dean of Nursing at Elms College. Both of these institutions are located in Massachusetts. This module was designed for healthcare faculty and students and will provide an overview of what is meant by interprofessional practice and education, and will also identify interprofessional competencies and the interrelation with social work and nursing competencies. This module will also provide a lesson plan for a combined class of social work and nursing students, which can be applied across disciplines. Last, the module will highlight pedagogical tools to aid in the delivery of interprofessional education. This module has been approved for one continuing education unit in social work and in nursing. This Behavioral Health Workforce Education and Training Grant is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The grant is entitled the Interdisciplinary Behavioral Health Collaboration Project. This information or content and conclusions are those of the author and should not be construed as the official position or policy or endorsement inferred by HRSA, HHS, or the U.S. government. There are several learning objectives, and at the conclusion of this module, participants will be able to define interprofessional education, also known as IPE, and interprofessional practice, known as IPP. We'll discuss the impetus for the IPP movement. We'll describe the principles and associated goals of IPE. We'll be able to describe the core competencies of interprofessional educational collaborative. We'll be able to identify competencies for nursing and social workers in team-based care, and apply the educational principles of interprofessional practice among nursing and social work students through a clinical case study. To provide context, we will start with defining the concepts that you will learn about in this module. The World Health Organization defines interprofessional collaboration, IPC, as when multiple healthcare workers from different professional backgrounds work together with patients, families, careers, and communities to deliver the highest quality of care. Interprofessional collaborative practice, known as IPP, is improved communication and shared participation in patient care between professionals that is coordinated to maximize patient quality and safety. Interprofessional education, IPE, is when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve healthcare outcomes. Interprofessional competencies are an integrated enactment of knowledge, skills, values, and attitudes that define working together across the professions with other healthcare workers, patients, families, and communities as appropriate to improve health outcomes in specific care contexts. IPE and IPC are not students learning by different professors in different disciplines. It is not just sharing an office. not just eating lunch together and discussing professions. It is not a top-down approach making decisions. Different situations warrant different professions being in charge. A team of experts is not an expert team. The following cartoon highlights the serious problem of medical error. Unfortunately, the number of deaths due to medical error continue to rise. In 2000, the Institute of Medicine estimated 98,000 medical deaths per year from medical errors. In the year 2016, authors Macquarie and Daniel estimate that medical deaths are at more than 250,000 per year. These patient safety errors are now the third leading cause of death in the United States. In 2003, the Institute of Medicine articulated 5 competencies that every healthcare professional should employ to deliver high quality and safety to patients. These include using evidence-based practice, utilizing informatics, providing patient-centered care, applying quality improvement, and working in interprofessional teams. In 2008, the Institute for Healthcare Improvement introduced the triple aim to advance the goal of enhancing patient safety, improving the health outcomes of the population, and controlling healthcare costs. In 2014, Bodenheimer and Sinsky proposed adding improving the work life of healthcare professionals, thus creating the quadruple aim. The 4 tenets of the quadruple aim help to close the gap between health education and practice settings and ensuring that the new generation of healthcare professionals are trained and skilled in providing interprofessional, team-based care. Therefore, interprofessional practice is really a philosophy. To meet quality and safety goals, health professionals view the patient in the center of attention to ensure the best health outcomes and that healthcare teams can best accomplish that goal when working together. Interprofessional collaboration is guided by a set of principles. It is patient and family-centered, community and population-oriented, relationship-focused, process-oriented but outcomes-driven, integrated across the learning continuum, applicable across professions, and sensitive to systems context. There are shared goals of interprofessional collaboration and interprofessional education. These are to build a safer and better healthcare system by improving team-based training, which will improve team-based patient care and fulfill the quadruple aim. How care is delivered is as important as what care is delivered. Beyond fulfilling the overarching quadruple aim, there are numerous benefits to interprofessional collaboration. Improving communication and conflict resolution, increasing efficiency, improving employee morale with less turnover, fostering creativity and ideas, reducing competition and conflict, increasing problem solving, enhancing learning, networking, increasing interstaff support, improve clinical outcomes, cost effectiveness and safety, strengthening professional identity, and facilitating collaborative projects. The U.S. healthcare delivery system lacked coordination across health professions. In response, the Interprofessional Educational Collaborative, known as IPEC, formalized a set of competencies needed by healthcare professionals.